My name's Simon Butler-Manuel. I'm a consultant gynaecologist at London Bridge Hospital, and I also work in the NHS at the Royal Surrey County Hospital in Guildford, where I'm the clinical director for gynaecological oncology, which is cancer treatment within gynaecology. I probably had a lack of imagination as a little boy. My father was an obstetrician and gynaecologist, and back in the 1960s, when I was born, doctors used to work extremely long hours. So I was almost brought up within a hospital environment. Many of my parents' friends were doctors, and so maybe I just lacked imagination. But no, I've just always had a calling to do medicine, really. Well, I probably was heavily influenced by my poor father, who died nearly 30 years ago. But as a medical student, I loved obstetrics and gynecology and the ultimate emergency medicine that is obstetrics. And I was drawn into the more surgical side of it. And I've ended up now, all these years later, as a gynecological surgeon. So I do the more surgical end of the spectrum. And I particularly specialize in more complex problems, such as cancer treatment and fibroids and endometriosis, and these more complex problems that require surgery. And in the early years after I qualified, I spent time in general surgery as part of my training, to give me a very broad base experience. I spent time in general surgery, vascular and urology, as well as emergency medicine. So originally I'm from the north of England, from the northwest of England, and went to school in Manchester before going to medical school in London. And I trained and qualified at St Thomas's Hospital in London. And then I stayed in the south of England, at London and the home counties ever since. I've been an NHS consultant at the Royal Surrey in Guildford for 20 years. And more recently, it's been very nice to return to central London at HCA London Bridge Hospital, where I consult. I think the most rewarding thing of all for me is seeing the look of satisfaction and pleasure on patients' faces, seeing everything come to fruition and allaying people's anxieties. People are always very fearful about the prospect of needing an operation, and it's nice with my experience to be able to allay people's anxieties, explain things in plain English for them, and do a good job for them, really. I like looking after people and seeing them through that journey.